ਮਾਲ ਦੇ ਵਿੱਚ ਫੋਨ ਨੰਬਰ
directly
516
like this
0555 403 516 0555
65 ਸਾਲ ਤੋਂ ਜ਼ਿਆਦਾ ਉਮਰ ਦੇ ਬਜ਼ੁਰਗ ਫ੍ਰੀ ਦੰਦ ਲਵਾਉਣ ਲਈ ਕੁਆਲੀਫਾਈ ਕਰ
Yeah,
ਸਕਦੇ
just
ਹਨ
now.
ਹਰ ਇੱਕ ਤਰ੍ਹਾਂ ਦੀ ਡੈਂਟਲ
So
ਸਰਵਿਸ
share,
ਦਾ ਰੱਖੋ
yeah, go in groups.
ਕਿਉਂ ਭਾਈ ਨਵਾਂ ਘਰ ਲੈ ਲਿਆ ਕਿ ਨਹੀਂ ਕਿੱਥੇ ਭਰਾਵਾ ਨਵਾਂ ਘਰ ਲੱਭਾ ਨਹੀਂ ਤੇ ਪੁਰਾਣਾ ਵਿਕਿਆ ਨਹੀਂ ਸਮਝ ਨਹੀਂ ਆਉਂਦੀ ਹੁਣ ਕੀ ਕਰਾਂ ਉਹ ਭਾਈ ਮੈਂ ਤਾਂ ਪਹਿਲਾਂ ਹੀ ਕਿਹਾ ਸੀ ਕਿ ਕਿਸੇ ਤਜਰਬੇਕਾਰ ਭਰੋਸੇਯੋਗ ਰੇਟ ਨਾਲ ਗੱਲ ਕਰ
So these are the ones which you have, which are the ones you want to start with?
Yeah. No. Go back. Go back, let me do it.
ਇਹ ਵੀ ਦੱਸ ਦੇ ਨੰਬਰ ਹੈ ਕਿਹਦਾ ਇਹ ਨੰਬਰ ਆ
The main screen.
ਕਾਰ ਖਰੀਦਣ ਤੇ ਵੇਚਣ ਦਾ ਲੰਬਾ ਤਜਰਬਾ ਸਹੂਲਤਾਂ ਹੋਰ ਬਿਜ਼ਨਸ ਜਾਂ ਕੋਈ ਕਮਰਸ਼ੀਅਲ ਪ੍ਰਾਪਰਟੀ ਖਰੀਦਣੀ ਵੇਚਣੀ ਹੋਵੇ ਤਾਂ ਨੰਬਰ ਯਾਦ ਰੱਖੋ 617 9045 ਤੇ ਨਾਮ ਯਾਦ ਰੱਖੋ ਬਿਲ ਕਰੋ ਪ੍ਰੋਫੈਸ਼ਨਲ ਆਨੈਸਟ ਅਤੇ ਫ੍ਰੈਂਡਲੀ ਸਰਵਿਸ ਲਈ ਮੈਕਸਵੈਲ ਨਾਲ ਕੰਮ ਕਰਦੇ
This was the first.
Okay, Iqtidar bhai, thank you. मैं आपका वो नहीं है, ग्रुप्स में
That's what I was wondering.
ਥੋੜੀ ਟੈਂਪਰ ਡਰਾਈਵ ਦੇਸੀ ਘਿਓ ਵਾਲੀਆਂ ਜਲੇਬੀਆਂ ਲੈ ਚਲੀਏ ਘਰ ਨੂੰ ਟੈਂਪਰ ਡਰਾਈਵ ਵੱਲ ਨੂੰ ਆਹੋ ਟੈਂਪਰ ਡਰਾਈਵ ਵਾਲਾ ਏਰੀਆ ਰੈਸਟੋਰੈਂਟ ਮਸ਼ਹੂਰ ਕੁੱਕ ਹਰਮੇਕ ਸਿੰਘ ਨੇ ਵੇਖ ਲਿਆ ਉਹ ਰੋਜ਼ ਤਾਜ਼ੇ ਦੇਸੀ ਘਿਓ ਵਿੱਚ ਬਿਲਕੁਲ ਜਲੇਬੀਆਂ ਕਰ ਦਿੰਦੇ ਆ
Just tell them go to radiosociety.com.
71 ਸ਼ਰਮੇ ਟੈਂਪਰ ਡਰਾਈਵ ਨਾਰਥ ਈਸਟ ਵਾਲਾ
Yeah, or you know, because I tagged you, you can just go on my Facebook.
ਸਾਰਾ ਮਾਲ ਖੁਦ ਤਿਆਰ ਕਰਵਾਉਂਦੇ ਹਨ ਹਰ ਤਰ੍ਹਾਂ ਦੀਆਂ ਮਠਿਆਈਆਂ ਸਮੋਸੇ ਅਤੇ ਵਾਈਕਦਾਰ ਵੈਜ ਜਾਂ ਨਾਨ ਵੈਜ ਖਾਣੇ ਦਾ
Yeah, that's right, yeah.
ਸਸਤੇ ਰੇਟਾਂ ਵਿੱਚ ਲੰਚ ਬਫੇ ਦਾ ਆਨੰਦ ਵੀ ਮਾਣੋ ਚਿਕਨ ਕੋਡ ਲੈਂਬ ਦੀਆਂ ਕਈ ਕਿਸਮਾਂ ਦੇ ਨਾਲ ਪਨੀਰ ਪਕੌੜੇ ਅਤੇ ਫਿਸ਼ ਪਕੌੜੇ ਵੀ ਮਿਲਣਗੇ ਆਰਡਰ ਕਰਨ ਲਈ ਨੰਬਰ ਨੋਟ ਕਰੋ 403 280 4885 ਇੰਡੀਆ ਰੈਸਟੋਰੈਂਟ ਆਜੋ ਲੰਬਰਦਾਰ ਜੀ ਲੰਘਿਆ ਉਹ ਆਪਣਾ ਹੀ ਘਰ ਆ ਉਹ ਭਤੀਜੋ ਮੈਂ ਤਾਂ ਭਲੇਖਾ ਖਾ ਗਿਆ ਸੀ ਵੀ ਕਿਸੇ ਹੋਰ ਦੇ ਘਰ ਆ ਗਿਆ ਜਦ ਪਿਛਲੀ ਵਾਰ ਆਇਆ ਸੀ ਨਾ ਡੈਕ ਸੀ ਤੇ ਨਾ ਗਰਾਜ ਪਿਆ ਨਾ ਹੀ ਫੈਂਸੀ ਰਹੀ ਸੀ ਲੰਬਰਦਾਰ ਜੀ ਤੁਸੀਂ ਐਚਐਮਪੀ ਪ੍ਰੋਫੈਸ਼ਨਲ ਕੰਸਟਰਕਸ਼ਨ ਦੇ ਪਾਲ ਸੇਖੋਂ ਨੂੰ ਜਾਣਦੇ ਹੋ ਇਹ ਉਹਨਾਂ ਦੀ ਟੀਮ ਦਾ ਚਮਤਕਾਰ ਆ ਪਾਲ ਸੇਖੋਂ ਤਾਂ
After this act. Thank you so much everyone for joining. Iqtidar bhai, happy birthday Salma Appa. There we go, Salma ji. Happy birthday.
Oh, happy birthday.
Yeah. She didn't bring the cake.
25 again?
She didn't bring the cake.
I think that's
I
our
don't
job.
eat cake.
No, we do.
25 and holding, right? Yeah.
25? I thought it was 19. Boogie sir.
25. Because in 25 you're legal then everything,
Yeah.
right? 19 then you're not legal somewhere, right?
That's
So-
right.
Thank you everyone. Thank you. It's Iqtidar Hussain.
Iqtidar bhai.
I didn't say it.
Yes, salam namaste, sat sri akal, adab and yali madad. Yes, guys, we are back.
Go Bandhu.
1 second. Oh, वहाँ पे radio. This is the fun to be live on the radio. Yes, you can. You know what are we doing. Anyways, guys, thank you so much again for joining us with our next guest, Amyn Kanjee. Thank you so much for coming in our studio.
Oh, my pleasure.
Thank you so much. And of course, we have our Salma ji, जो कि अपना birthday girl है today. Birthday girl today. Yes, happy birthday again, Salma ji, आपको.
Yeah, thank you so much, and it's been a great day and feeling good, and I got tons and tons of beautiful messages, and I want to thank everyone who has remembered me and sent messages to me, and it's very nice of everyone to remember me. So keep me in your prayers, and hopefully I'll celebrate another one next year.
Inshallah, inshallah. So first of all, Amyn Kanjee, thank you so much for joining us, and of course, like coming to our studio. So who's Amyn Kanjee? We don't know you that much, or not our listeners or viewers knows you.
How much time do you have on the show?
We got almost 40 minutes.
Almost 40 minutes. Okay, I'll try and condense it. So, who is Amyn Kanjee? Well, first of all, he's a husband and a father.
MashaAllah.
And he's also a pharmacist, so a health profession.
Okay.
I've been a pharmacist for about 27 years now.
27 years.
27 years.
Wow.
But I'm only 29, so
Yeah,
I started when I
that's
was
so
2.
nice. Yeah.
Yeah.
So similar in age.
So similar in age. I'm a practicing pharmacist. I graduated from University of Alberta. I did my degree in pharmacy, and then I did my residency at the
Nice.
Foothills Hospital,
Okay.
and then have been in community pharmacy for the last 27 years.
Nice. Wow.
Oh, that's very nice. Yeah.
So you were on a QR77, I think week or 2 weeks ago,
That's
3
right.
weeks ago.
Yeah, that's right.
So it's
yeah.
an honor to have you here. I think we are very fortunate to have you.
Yeah, no, it's my pleasure. I truly believe in educating the public about health and health-related issues. And as we get older, and we have birthdays, we have to look after our health, right?
Yeah,
And
that's
so,
right.
That's right.
it's my passion to talk to patients and clients and the public about how they can protect themselves, with things like the flu or shingles, pneumonia, all sorts of diseases that were so common and are so common and so common to be afflicted with as well too.
Mm-hmm.
But there's so many things we can do
Right.
to be proactive other than just healthy diet and exercise and all of that. There's more things that pharmacists can actually help
Okay.
patients with as well too.
Wow. So now
That's
you-
right. Yeah, so how, I'll be talking like a layman today.
Yeah,
So how important it is for everyone to get vaccinated?
So it's very, very important.
Yeah.
There's a term we use that's called herd immunity.
Mhm.
So herd immunity is when more people get vaccinated, we're protecting society in general more.
Mhm.
All it takes is one individual who's sick
Mhm.
who can then make other people sick. So when you think about, even though some people say, I'm a very healthy person, I never get sick, but it's not about you, it's about other people, right? It's
Mhm.
elderly parents, it's
Mhm.
grandparents,
Mhm.
it's your nieces, your nephews, young babies that you may have in your family, that you're then exposing them with, potential flu virus or, other sorts of viruses. So
Mhm.
again, it's not all about us, but it's also about, the more people that get
People around
vaccinated,
you.
the more people that are protected, right? So we have to
Mhm.
do this as sort of something that we do for the greater good of humanity, right?
Mhm.
So
For
that's
sure.
really important.
Yeah.
Yeah.
So yeah.
Yeah, so if I take you back, if you remember, when we had a SARS in Toronto,
Right.
I think since then, like for like the government of Canada, Alberta, and everyone now they are putting more to the flu vaccination,
Right.
the flu. They are like more educating
Yeah.
people now.
Yeah.
So what changed after that? Like what was?
So I think the strain of the virus changed,
Mm-hmm.
and every year, it changes, and we're seeing more chronic conditions, more people being admitted to the hospital,
Right.
more people going to emergency. We're living longer as well too.
Mm-hmm.
Right? So as we live longer, we're more prone to getting, diseases and conditions that typically first we weren't afflicted with.
Right.
So now, we're seeing more hospitalizations,
Mm-hmm.
and the flu virus is constantly mutating. That's why every year it's slightly different.
Exactly.
Right? We don't use the same vaccine
Yeah.
every year.
Yeah.
There's a reason for that.
Mm-hmm.
Because every year the flu virus, mutates a little bit, it changes a little bit, it becomes more resistant to treatment, and so the vaccine has to change as well.
Change with that.
right?
Yeah. Okay.
And sometimes, they do get it wrong,
Mm-hmm.
but it's the best guess scenario, right? We can only stay on top of it as
Right.
much as research stays on top of it as well too. So
Mm-hmm.
yeah, so that's why it's really important.
Mm-hmm.
And as people are getting more chronic conditions, if you get the flu, it really, really can be debilitating, and also sometimes in few cases cause death,
Right.
right? Because it really affects your immune system.
Mhm.
So I know everybody's supposed to take vaccines
That's right.
and the flu shots, but tell the public, who are more prone to
Yeah.
get infected. So these are really important. To
So,
which
so,
part
so
of-
children,
Yeah.
so children obviously
Mhm.
are first that come to mind.
Yeah.
Flu vaccine is recommended for children over the ages of 6 months.
Mm-hmm.
Just because they're more vulnerable, their
Right.
immune system is not developed yet. So
Mhm.
first of all, kids, then the elderly.
Mm-hmm.
The elderly that have chronic condition, if we have diabetes or heart disease, COPD, asthma,
Mm-hmm.
you're very prone to getting sick. So those
Mhm.
are the other population. The Aboriginal population as well,
Mhm.
and also, people who work in settings where they're exposed to a lot of illnesses as well.
Mhm.
So school settings, hospitals,
Mhm.
healthcare workers. If you're dealing with the public, you're more prone to getting sick as well too.
Mm-hmm.
And then anyone that has chronic conditions, whether you're 89 years old and have diabetes, or whether you're 29-year-old and have diabetes, you
Mhm.
have a chronic condition
Mm-hmm.
which makes you more vulnerable to getting sick and getting afflicted with the flu virus as well.
Mm-hmm. So it's guy like me, I always keep Tylenol with me all the time.
Mhm.
If I get something, if I'm not feeling good or my
Right.
throat something, I just take a Tylenol right
Yeah,
away.
yeah.
Is that a good thing? Because I know a lot of people from our community, they
Yeah.
keep the Tylenol in the
Yeah.
car.
Yeah.
At work,
but it's not
bad right away.
Yeah, but it's not prevention.
Mm-hmm.
It's treatment after the fact.
Mm-hmm.
And Tylenol can only help with certain things, like if
Exactly,
you have
yeah.
fever or pain.
Yeah, yeah, yeah.
But what we're trying to do is prevent you from getting to that point, right?
Right.
Because sometimes Tylenol doesn't take care of, it's not an antiviral, it doesn't help
Right.
against bacteria, It doesn't help against viruses. All it does is mask the symptom or help with the symptom.
Mhm.
So it helps with the headache. It helps with maybe fever. Like
Fever.
when you have flu,
Mm.
you have a really, really high fever.
Right.
So Tylenol is certainly important to help with the fever, so you don't get convulsions, you don't get epilepsy, epileptic seizures
Yeah.
due to high fever.
Mhm.
But it's only helping with the symptom. It doesn't actually help prevent the actual cause of the
Actual
condition,
cause.
right?
Yeah.
Yeah. So that's why it's really, really important.
Mhm.
Yeah. So the question was that like it just came and just slipped my mind. Yeah. So some people are scared.
Mhm.
Like when I talk to them, and I'm always telling, please, did you
Yeah.
take your flu shot? Did
Yeah.
you
Yes.
So they are scared that when we get the flu
You get sick.
vaccine,
You get sick.
you
Yeah.
get sick.
Yeah.
So how
So-
far is it true?
So that I hear a lot of that all
Yeah.
the time, right?
Yeah.
Last time I got the flu vaccine, I got really sick.
Yeah.
I'm never getting the flu vaccine
Yes.
Yeah,
again.
Yeah.
that's right.
So what we do recommend is when we give you the flu vaccine, we sit down and go through a questionnaire with you, right? To make
Mm.
sure
Yeah.
that you are
Yeah.
eligible to receive the vaccine. There's no contraindications.
Mhm,
You don't have any allergies to the components that's in the vaccine.
mhm,
You don't have that fever that day.
mhm.
And sometimes because flu can happen, you can actually have flu a day before you actually have symptoms.
Mhm.
So maybe in that individual, they already are, getting sick, and then they get the flu vaccine, and then they get sicker,
Mhm.
right? But they already perhaps were not well to
Yeah.
begin with, right?
Mhm.
So, the flu symptoms can start 1 to 3 days before you actually get flu. The
Mhm.
flu virus can also live on hard surfaces, right?
Oh.
So it can live on hard surfaces. So even if someone has had the flu and they've touched the counter, a day later, if I go and touch the same counter, I can get infected,
Wow.
right? So it's not person to person.
Yes.
It's also person to inanimate object or
Yeah.
countertops
Yeah.
or pencils in school or desks, whatever kids are
Mhm.
touching, right?
Mhm.
And kids always play in close proximity with each other,
Mhm.
so it's very quickly to spread the virus,
Mhm.
easily.
Mhm.
Especially
So
when
you-
you're in long-term care, like if you have an outbreak in long-term care,
Mhm.
you have all patients there who are there because they're vulnerable, they're older,
Yeah.
they have chronic conditions, and all it takes is one patient to have the flu virus and it
True.
spreads in
Yeah.
the whole facility, right?
That's
Right,
right.
that's
That's
right.
right.
So even if you go to doctor now, they won't give you the prescription or the antibiotic right away.
No, because
So why is
antibiotics-
that? Because they know this is like
yeah,
it's gonna get better.
so influenza is caused by a virus. So
Mhm.
antibiotics don't work.
Mhm.
Right? We think it's an infection, but it's not necessarily infection.
Okay.
The symptoms, are very similar to some infections,
Mhm.
and so that's why patients think, okay, if I take an antibiotic, it's going to help.
Yeah.
But
Yeah.
antibiotic is only for bacteria. This is a virus,
Mm.
right? So you're not treating the cause
Cause,
of
yeah.
what's causing the symptoms.
Yeah.
And sometimes it's very confusing because the symptoms are very similar. Do I have a cold?
Yeah.
Do I have the flu?
Mm.
Right? So the symptoms are very similar. But with the flu, you actually get body aches, muscle ache,
Mhm.
really high fever.
Mm.
All of a sudden, onset of fever is very high. You get a headache. Whereas cold, you don't get those symptoms. Yeah, you get very similar symptoms like sneezing,
Right.
runny nose,
Right.
mild fever. But with flu, you get a really, really high fever very quickly. You get muscle aches. You're fatigued. You can't get out of bed. That's not typical with a cold. That's
Okay.
more typical with the flu.
Oh, okay. Okay.
Yeah. So now these days, it is recommended that you should take shingles and pneumonia vaccine.
Mhm.
So how important it is, and what age is you say it should be given?
So let's talk about shingles first. So
Mhm.
shingles is actually caused by the chickenpox virus. So most of us that grew up and had chickenpox obviously have the virus in us.
Right.
As a child, we've had it, and as we get older,
Yeah.
with our immune system going down, with stress in certain situations, the virus reactivates, and what it does is it actually affects the nerves, and it can be very, very painful.
Mhm.
Okay, so the shingles vaccine typically we recommend it for ages 50 and up.
Mhm.
It's 2 doses. It's called Shingrix. You take 1 dose, at day 0, and then 2 to 6 months down the road, you get your second dose. And that should hopefully, it may not prevent you from getting shingles, but it may prevent you from getting a severe case of shingles.
Mhm.
So you may not be debilitated for weeks or months. You may only have the symptoms for maybe days or maybe a week to 10 days, and it may be something that you can manage. But
Mhm.
sometimes shingles does cause hospitalization
Mhm.
because it's very, very painful. And once you have it, you're prone to getting it again. So we
Oh.
recommend getting vaccinated at the age of 50 and above. And some patients who are prone to getting shingles when they're younger, we also recommend maybe for that group also to be vaccinated as well.
Okay.
But again, there's different protocols out there. But we certainly make sure that if you're 50 and over, you definitely should be vaccinated against shingles.
And what about pneumonia?
Pneumonia, so anyone that's over the age of 65 should get pneumonia vaccine. That's typically given to anyone in the province of Alberta that's free. The government provides that free. Pharmacists can do the vaccine. Physicians' offices can do the vaccine for free. Some patients who are younger than 65, but again, if they have chronic conditions like they have diabetes or asthma or COPD, heart disease, then we say, you know what, at that age, even if they're younger than 65, we do recommend pneumonia.
Okay.
Because if they do get sick with pneumonia, it's harder for
Yeah.
those individuals.
Yeah.
So that's why pneumonia is recommended for 65 and over, but also for some subsections of individuals that are under the age of 65.
So just for I'm going to take you back to flu symptoms. Okay? So especially the kids, because
Yeah.
they're easy to get.
Yeah.
So my daughter goes to school. There are like 600 kids there.
Right.
So being a parent, how do you what do you do?
Well, I think
Because you do your best.
You do your best, but
Yeah.
then I think you also have to educate them about, I think it's our parental right to educate, kids about what to do when they're sick. So again, sneezing in your, in your arm, washing your hands frequently. Those are the basic things. That's all you can do, right? You can't force other kids and
No.
other parents to vaccinate their kids
Yeah.
if they don't want to.
Yeah.
But I mean, what you can do is, you can certainly educate your child about, okay, if someone is sick, maybe perhaps don't share,
Right.
similar, the desks, or maybe, wash your hands frequently.
Right.
Because, those are some things that we typically don't do, and we can pass the virus on
Pass.
very easily.
Right.
Right? So there's certain things that we can do to protect ourselves.
Mm.
Just because we've got the vaccine doesn't mean that,
Exactly.
You
Yeah.
need to
You know.
forget about all these
yeah,
Yeah.
forget about all the other
Yeah,
things, right? That's
yeah.
important. So
Yeah.
hand washing,
Yeah.
sneezing in your arm rather than
Right.
out in the open. Not coughing on someone as well, coughing on the
Exactly.
side, and all those things that
Those
children need to be
minor thing
educated about.
makes a big difference.
Oh, absolutely.
Yeah.
Absolutely. Yeah.
Because if you have a snow tire, doesn't mean you won't slip.
That's right. Yeah.
You know
There's
what I
no
mean?
guarantee. You still have to
Yeah,
be
there's no
careful.
guarantee. Yeah.
Yeah, you still have to be cautious, right?
Exactly.
Yeah, yeah, absolutely. Yeah.
So what about this when you reach the age of 70 and then they recommend that okay you take a double dose of a flu vaccine?
Right.
Because, so what is that?
So it's called a high dose vaccine.
High
It's,
dose.
so it's a high dose vaccine, and it's for elderly population who are more vulnerable.
Mm-hmm.
So if you again are older, over the age of 70, if again you have chronic conditions, there is another vaccine that's available. It's called high dose flu zone. It's not covered by the province. So sometimes cost can be a limiting factor with the patients getting it. Right now it's not available, it's in short supply. We are thinking that it's going to probably be available in December, so in the next few weeks we should hear more about its availability. But it seems to be late coming to the market this year. But there are some individuals that should consider getting the high dose. It's about $75 roughly, for that vaccine. And some people opt that they want that because they've had so many cases of flu in the past, or they've been
Yeah.
sick
Yeah.
with the flu, that they should probably think about getting the high dose flu vaccine.
So like of course we live in Calgary, Canada, so the weather is cold, and our people they love to drink cold drinks.
Mhm.
Is that safe in the winter time?
There's nothing wrong with that.
No?
It's a myth, it's a myth saying, if you drink cold drinks,
Yeah,
you're
exactly.
not gonna get sick.
Yeah.
If you, obviously you have to cover yourself when you're outside. There are things to protect yourself as
Right,
well from
right,
getting, really cold in the
Yeah,
bitter
yeah.
cold. But those are all myths, right? Because
Mhm.
again, it's a virus.
Virus.
It's transmitted from person to person. But you have to actually transmit the virus, so it's not something you're drinking or doing.
Okay.
Again, obviously hand washing and hygiene is really
Those-
important.
Very important.
But having something cold to drink in cold environment doesn't mean that
Doesn't
you're
mean
gonna
that
get flu.
you-
Yeah,
yeah.
no,
Hmm.
no.
So the way you are educating through our radio today,
Mhm.
is it very normal that they do it in schools and public places? Do they do this?
So they
kind
don't.
of
So they don't
talk?
have a campaign to do it.
Yeah.
Alberta Health Services used to do it in schools
Yeah.
before, but now I
Right.
think the onus is upon the parents and the teachers to again go to into the public health units. There's flu clinics that are set up, which are open to the public. So anyone can go there for free and get the flu vaccine. There's no charge as long as you are an Alberta resident.
Right.
You can walk into any pharmacy.
Is that right?
You can go to the doctor's offices.
Yeah.
Sometimes there's no appointment required. So I currently own a pharmacy in Killarney.
Okay.
It's called the Medicine Shop Pharmacy. So we provide flu vaccine there. No appointment needed. You walk in. Pharmacists are only able to vaccinate children 5 and above.
Okay.
So that's one thing that we do have to keep in mind. And also for pregnant women, we talked about vulnerable population. So pregnant women are also vulnerable. So it's also recommended that they get vaccinated as well too.
Yeah. And because I've seen in our community, when kids, especially kids, or the senior members as well, when they get cold, flu, they say, oh, it's just a flu, take a Tylenol or any, over the counter.
Right.
But if it doesn't get better in 6 days, 5 days, 6, 7 days, then it gets serious.
Yeah.
Then they get worried, we should have gone last week.
Yeah. So there is once if it's diagnosed as the flu, there are medications that we can give. It's called Tamiflu. Tamiflu. So that's given for treatment as well as prophylaxis. So prophylaxis is preventative. Let's say you're working in a facility where someone has the flu and you're a healthcare worker. Sometimes they may mandate you that if you haven't had the flu vaccine, that you go on prophylactic, preventative treatment.
Yeah.
So at that point, and it takes usually about 10 days. So if I get the flu vaccine today, my immune system is not active at least for 10 days. It takes 10 days to build that immunity.
Oh, okay.
So, especially even if you're traveling, right now in the wintertime, a lot of people travel, right? They go on planes, they go to other countries where there may be a flu outbreak. So again, even for travel purposes, we do recommend, getting vaccinated even for that reason. Because people say, oh, I'm going to a hot country, I don't need the flu virus because it's not there. But that's not the problem. The problem is that, when you're on a plane, when you're traveling, you're under stress, you're touching things, you're in a closed environment, air circulation is not that good. You have one person on the plane that has the flu, and you can spread it to everyone that's traveling with you, right? So it can ruin your holiday, right? So,
True.
That's right. Yeah, especially like when people go for a pilgrimage, they recommend that.
Yes.
Because they all come back sick because
That's
there's
right.
so many people,
That's right.
and then they're in so close contact
Yeah.
and that like
And
surfaces
especially
and
this
things
time
like
now,
that,
because when we're talking about coming up to Christmas and when there's parties and people get
Yeah.
together
Right.
and there's family gatherings and you go visit family and friends outside, maybe in some grandmothers in a home, or someone's not well and you go visit them in the hospital. People come together more so in the winter time, right? And they stay indoors more.
Right.
So there's more chances of spreading the virus because you're in close contact. You're with other people, you're visiting friends and families, you're traveling to see other family members in other parts of the country as well, so you're more prone to infecting each other as well too. And we've had a lot of, this year the flu started early. So typically the flu vaccine, so the launch of the flu vaccine season is sort of third week in October.
Okay.
I think this year, even by the third week in September, we already started seeing cases of flu.
Is that right?
And so we started vaccinating earlier. Typically, the date that we were supposed to vaccinate was October 21st or so.
Okay.
But this year, Alberta Health said, you know what? As soon as you get your vaccine, if people come in and ask for getting the vaccine, just give it to them. Don't wait because we already have the flu.
Oh,
So there's been hospitalizations with the flu.
Wow.
Yeah.
There's so much awareness about all this, but how much percentage of people do you think
So-
we get them
so
to get the vaccine?
Surprisingly, only 30% of Albertans.
Only 30%.
30% of Albertans.
Even after all this awareness.
Even
Oh,
after all
God.
of this, yeah. So I
So
think
why?
the
Why is it
statistics
like
from
this?
2017 were only 30% of Albertans actually got vaccinated.
Why though?
So I think it's the same things we talked about, right? The myth
Yeah.
that I'm going to get sick if I get the vaccine,
Yeah.
or they don't think about it, they don't believe in it.
They don't believe that is
They
what.
they feel like that's not something that's going to affect them.
Mhm.
Right, so what we're doing is we're protecting only 30% of the population, but there's 70% that are vulnerable,
Yeah.
right? So again, the uptake is very low, even though the accessibility is high,
Yeah.
right? You can get it, like I said, any pharmacy, any pharmacist, public health clinics, doctors' offices, Most employers now, like when you walk into a hospital, they have flu clinics there for the staff there to get
Mhm.
vaccinated,
Yeah,
right?
yeah.
So they're making it more accessible, right?
More simple.
So there should be no reason why we are not seeing a higher uptake in
Mhm.
vaccines. Sometimes it's not just not having the time, or I never thought about
Yeah.
it, but I think we do need to make the time and be educated about
Yeah,
it as well.
that's right.
Because I think it was in the news, I think about a month or so, they were saying I think Alberta is more targeted for the flu right now.
Yeah,
Because people are not getting the flu
that's
shot.
right.
I mean,
Yeah,
that's what it is.
yeah, and I don't know what the statistics are in other provinces, but
Yeah.
in Alberta, definitely, access is is made so much available
Mm.
that there's no reason why.
Mm.
Everyone has a pharmacy in their
In
community.
the community.
Yes.
You have access to your physician. You have access to public health units. So there's no reason why you shouldn't be vaccinated.
Right.
So, what is the chance of getting a flu even though you got vaccinated?
So there's always a chance. It's not 100% foolproof, right?
Yeah.
So, but what I always tell the patients who ask is, at least you won't be debilitated for a long period of time, right? So especially when you're concerned about whether missing work or missing family gatherings or whatever, it shortens the duration that you perhaps would be sick.
Mhm.
It may prevent you from being hospitalized. You may be able to treat yourself
Mhm.
at home with symptomatic treatment, with over-the-counter remedies like Tylenol or Advil or
Mhm.
something to help with fever and pain, but it may prevent you from being hospitalized, right?
Yeah.
Mhm.
And that's what we want to try and prevent is,
Yeah.
healthcare costs are very high as well.
That's right. Yeah.
So, I think we're doing a service to managing our healthcare system if we all take our responsibility and
True.
protect ourselves,
Yeah,
right?
Yeah.
that's so true.
So same goes for shingles, same goes for,
Mm.
pneumonia as well too, right?
Yeah.
So we have to be careful that, we're doing what we can
Yes.
to protect ourselves so that we're not a burden on the healthcare system.
Of course. Of
Yeah,
course, yeah.
that's so true.
So I think like nowadays you've seen like a lot of young or youth, they use the vaporize or vapor.
Mhm.
Now I think it was vapor.
Vape.
Yeah, the
They
vaping,
do
yeah,
vape.
yeah.
It was on the news on the weekend, especially in the US. There are, I think there are more cases of
Right.
it's
Yeah.
an infection or whatever. They
Yeah,
What,
yeah.
what is maybe you can
So
more details.
vaping was considered to be sort of the substitute for smoking.
Smoking.
And it was always thought that the perception out there is it's a safe
Yeah. Right.
way, and
Yeah.
it's cool to vape now.
Right.
But what we're finding out now is that there is real harm that causes to the lungs,
Mhm.
and especially in young youth who
Right.
feel that vaping, just because it doesn't have nicotine and
Yeah.
it has a flavor and it's cool to do that, and it comes in really neat devices.
You're right. Exactly.
Yeah.
It's really cool to do, but
Yeah.
now we're finding out that that inhalation can cause a lot of damage to your lungs,
Wow.
right? Because you're actually inhaling smoke.
Yeah.
And some vape juices, I guess they call it, are also have nicotine in it,
Mhm.
and some have cannabis in it as well
Mhm.
too, right? So
Yeah.
you have to be really careful about what it is that you have in your vape,
Yeah.
but it's not benign. I mean, it is
Yeah.
harmful,
Yeah.
and the more you do it, the more your risk.
Because I was talking to one of the one of the person, and he said he does he does use the vape. He said I don't use the cheap stuff. I use the expensive one. That one is okay.
Yeah, yeah.
I was like, I don't think so.
Yeah, no, I don't think so.
No,
Yeah.
right?
It's just like when you smoke a cheap pack of cigarettes or an expensive pack
Yeah,
of cigarettes, right?
It's still the same
Whether
thing.
you use cheap alcohol or expensive alcohol,
Yeah.
it's still alcohol,
Right,
right?
still alcohol,
It's
yeah.
still a vice. It's still harmful,
Yeah.
right? So
That's right.
I mean, it's so you have to be careful, and if you're going to do it, educate yourself about it.
Yeah.
Look at the risk factors. Look and see what's happening out there.
Mhm.
Make sure that you're going to a place that can give you the education.
Mhm.
Because all you can do is educate yourself about
Educate,
it, right?
yeah,
Yeah.
exactly.
But I mean, there are cases that we found now in the States and in Canada. We're seeing youth being hospitalized.
Yeah.
Yes.
That's right.
With severe cases of lung infections and
Because of the vape.
because of
Wow.
vaping,
Yeah.
yeah. So.
So, all these questions are coming to me. I said it's so important for the public to know about this vaccination. So, what other messages you want to give to the public regarding this?
So I think also, it's really important to be educated.
Mhm.
Obviously, managing your chronic condition is important. If you have diabetes or high blood pressure, how do you manage those conditions?
Mhm.
Some people even say to me, well, you know what, I've got blood pressure. I'm on blood pressure medication,
Mhm.
but now my blood pressure is fine. can I go off my blood pressure medication?
No.
Well, no, right? Because your medication is controlling your blood pressure,
Controlling, exactly.
and that's why you know.
Yeah.
Yeah.
And a lot of people also are, they don't want to take their cholesterol medication
Mm-hmm.
because they say, my cholesterol's fine. And you typically, those are diseases where you don't have symptoms, right?
Yeah.
How does one feel when they have high cholesterol? They
Yeah.
don't feel any different,
True.
right?
Yeah.
But
True.
what it does is causing damage in your
Yeah.
blood vessels,
Yeah.
right? And it's causing clogging of your capillaries and your veins.
Yeah.
And
Yeah.
so again, you have to really be educated about it.
Mm-hmm.
Diabetes is another thing. We're seeing more and more diagnosis of diabetes.
Mhm.
Type 2 diabetes. So because of the lifestyle we lead, because of the food we're eating, so again, making healthy choices as far as your diet,
Mm-hmm.
your exercise. Sometimes if you are careful about what you eat and your weight and your exercise, you can actually prevent. Because there's a stage called pre-diabetes
Mhm.
where you're at the brinks
Yeah.
of, being a diabetic.
Mm-hmm.
But if you control your weight and exercise and your diet, you can prevent you from becoming diabetic. Because once you become diabetic, then it's hard, then it's a lifestyle change. You have to be on medications, which
Yeah.
causes side effects. It affects your kidneys, it affects your eyes, it affects your, your extremities, it affects your nerve endings. So many complications, right? I mean, kidney issues are big with patients who have diabetes that are
Mhm.
uncontrolled, right?
That's right.
Yeah, because your diseases are coming up like
Yeah.
new and new every day.
That's
Like
right, yeah.
yes,
Yeah.
wow.
Yeah, and I mean, there's medications are trying to keep up. There's new and
Yes.
new medications
Yeah.
out
That's
there.
right.
Yeah.
But more and more expensive treatments as well. And newest is not always the best, right? So
Right.
we always think, this is the wonder-all, one-drug treatment, but sometimes that's not always the best treatment.
Right.
So we have to be careful about that as well. And you know what? We all have a responsibility to manage our healthcare system to make sure that it's viable for our kids and their kids as well.
Mhm.
So what we do today can impact how our kids access the healthcare system and their kids access the healthcare
Yeah,
system.
yeah.
We want to leave it in a, it's like leaving your bank account, right?
Yes, yes.
You put
yes.
money in the bank, you're saving for the future.
Yeah.
You want to make sure that you're saving for the future.
Yeah.
Same thing, we have to look at healthcare the same way
Okay,
as well
same,
too.
Yeah.
because this is
Exactly.
investment.
Yeah, because if
So
we
you know-
abuse it, then
Mhm.
it's not going to be there for our kids when they need
Yeah.
it,
That's
right? So,
right. Yeah.
So with this new the new government, I don't know if you can if you can answer that or no. So now they are cutting for education. Teachers are cutting
right.
back.
Yeah.
Anything with the Alberta healthcare right now, or we are
Yeah,
okay?
so there are cuts that are coming. I
Is
think
there
one
right
of the seniors, I think, are one
Mhm.
that are affected.
Mm.
From what I've read and what I've heard is also that for example, if you're a senior and you're on and you have a spouse who's not a senior yet, so they haven't reached the age of 65,
Mhm.
automatically before, if they were 65 and over, they would be covered under your plan. And even if
Okay.
they were 60, they would still be covered under your plan. So that's changing now.
Okay.
So your spouse has to be 65 and
65
over now to
over.
get coverage as well.
Oh.
And
Okay.
then just as of today, there's some changes coming down as far as what the government is going to pay for certain types of medications, so certain
Mhm.
cholesterol medications,
Yeah.
certain blood pressure medications. They're only going to be paying for the cost of certain medications of what that cost is. So if you're on a different medication, now if you don't want to pay the extra cost, you may have to switch to another medication,
Mhm.
which may not be effective,
Mhm.
which may not give you the blood pressure control and the cholesterol control that you've had.
Oh.
So again, those are things that the government's doing, trying to obviously contain costs.
Yeah.
But again, it may not be the right approach. It may not be helpful for the patient. It's hard
Mhm.
for doctors and pharmacists to now manage their patients because now you're switching medications, and
Right.
once you're stable, if you switch, then you're all of a sudden not controlled. You
That's
may have to
right.
go
Yeah.
through a bit of trial and error to see how to control your blood pressure. Right?
Yeah.
So,
Wow.
so there are
That's
changes,
right.
but I mean, there are cost cuttings.
Cost, right?
We know it's not a bottomless pit. We have to do
Yeah.
something to
Right.
contain costs.
Oh, I guess so. Yeah.
Yeah,
Right,
of
that's
but
course,
we can
yeah.
contain costs by decreasing hospitalizations, by looking
Right.
after ourselves,
Yeah.
taking better care of our health,
Mhm.
controlling our chronic conditions as much as we can,
Mm.
making sure that we're not on dialysis or getting to the point where we
Yeah.
have to be on dialysis because the
Yeah.
cost of that is very
Yeah, it's
expensive.
very
as well.
expensive,
Yeah,
yeah.
so,
Yeah, yeah, that's right. No, that's so nice. Lots of people I don't understand. Like when we tell them, how important
Yeah,
it is to
yeah.
look after yourself and to get vaccinated. Like I'm myself. example of that, like I've got 2 grandkids. Whenever I visited them, they must be the carriers, you know,
Yeah.
bringing them from school.
That's right.
Every time I visited them, I got really, really sick.
Yeah.
And I said, no, this has to stop, you know,
Mhm.
because for a few days I was in bed and could not do anything.
Yeah.
But for last 5 years, touch wood, I've been taking my vaccination.
Mm-hmm.
Every
It's
year,
working.
Yeah.
5 years,
Yeah.
Right.
I haven't had
Yeah.
flu.
Yeah.
Like, so it, you know, see, I tell
It builds your
everybody
immune
this,
system.
yeah.
Yeah.
And you have to look after yourself. That is that's what
That's
you
right.
said.
Yeah.
That's the most important thing,
Yeah.
you
Yeah.
know,
Yeah.
proper diet, proper exercise, sleep,
Yeah.
you know, what you eat, what
Yeah.
you do, and all those things are the factors.
Absolutely.
With the vaccination,
Mhm.
you know, like if you don't look after yourself, and as you said, diabetes and blood pressure and these chronic conditions,
Mhm.
and of course you are prone to it, then you
Absolutely.
have to look after
That's
yourself.
right. Yeah. Yeah.
So these are the important things
Yeah.
which, you know, everybody is educated here, but
Yeah.
when it comes to these things,
Yeah.
I don't understand
Yeah.
what are they thinking,
We
you
go
know?
blank, yeah.
Yeah.
Yeah,
So I
this
think
is-
we always think it's never going to happen to me.
Yeah, this
Exactly.
never, I'm
Or,
healthy.
you know, I'm healthy.
Yeah, and it
but,
will never happen,
yeah.
yeah.
So I
And,
think
and you know, just one more question on the, like, you know, if you go to hospital in emergency, so you have to at least 4 hours.
right.
So what do you want to message to our viewers and listeners? You know, like, what if we do at home instead of
Yeah.
going to the hospital?
Yeah.
And put
there's
a
lot
more
of things.
burden there.
So I guess one of the reasons is why you went to the hospital. Right?
Mhm.
What are the things that bring you there?
Mm.
Obviously, there's certain conditions where if you're not
Right,
feeling well,
of course,
you have
yeah.
to go, right?
Yeah.
But you know, now, I mean, you know, as a healthcare professional, as a pharmacist, you know, I have the ability to prescribe medications for, you know, minor ailments. So for
Mhm.
example, you know, if you are not feeling well, based on your symptoms and an assessment that can be done very quickly with a pharmacist.
Mm-hmm.
You know, pharmacies are now open, you know, till midnight.
Yeah.
at
Midnight
least.
now, yeah, at
Yeah.
least.
You
Yeah.
have access to a healthcare professional. You don't need an appointment.
Yeah.
You know, whereas, you know, family doctor may be closed at 5.
Yeah.
You know, you can actually access health easily through your pharmacist. You know, we are able to, most pharmacists now are able to prescribe medications.
Nice.
We're able to extend prescriptions. We're able to adapt
Okay.
medications. You know, I also do a lot of travel medication as well too. So
Mhm.
even when we travel, sometimes we bring diseases back.
Yeah.
Yeah.
Like, you know, if you travel to India,
Yeah.
you know, people say, oh, I've lived there all my life. I'm not going to get sick.
Yeah.
But you do bring back,
Yeah.
you know, things like typhoid fever. You have to be careful about hepatitis, you know, malaria.
Yeah.
Yes.
You can bring all those things back
Yes.
with you. So even though you've lived there for many years of your life, you have to make sure you're protected, because what you
Yeah.
go and you bring back from there, you're then infecting other people here,
Yes.
Mhm.
right? So you have to be also careful. So I do a comprehensive travel consult with
Mm-hmm.
clients who are going away,
Mhm.
and I do an assessment to see where are they going, how long are they going for, what are the diseases they have to be
Mhm.
careful about, how can we protect you before you travel,
Yeah.
so that you can get
Wow.
your vaccination. So not only your flu, but you know, there's hepatitis A,
Yeah.
hepatitis
Other
B,
vaccines, yeah.
typhoid, cholera, malaria
Yeah,
pills,
yeah, yeah.
Japanese encephalitis, rabies, all those things you can protect yourself, you know.
Wow.
And you know, travel is getting more and more exotic. People
Right.
are going to different places,
Yeah.
right? So you can bring back a lot of things. You know, there was a case I think in Calgary where a child went to Asia and then went back to school after Christmas holidays and brought back typhoid fever.
Mm.
So again, you know, they could have been prevented
True.
if the child had been vaccinated
Vaccinated,
against it, right?
Yeah.
Wow.
Yeah. Yeah.
You know, this is never enough. You know, this kind of talk never enough, because always something
Absolutely,
new,
yeah.
always something new is
Yeah.
coming
Yeah.
every day.
That's
eh?
good.
Yeah.
Good.
Well, I'd love to have you back,
Yeah,
inshallah.
absolutely, yeah.
Yeah.
Absolutely.
I think we'll do it again, inshallah, for
Maybe
listener
for
viewers
the
listening.
next birthday.
Oh.
We can do
That's
this
true.
an annual
I
thing.
don't mind.
Every
Oh,
birthday.
okay.
No, in 3 months.
3 months. Okay.
January we'll do it.
January, okay.
No, it's good, and from your busy schedule you could come. That's very kind of you, and it's very important that, you know, like we make people aware of how
Yeah.
And,
important.
you know, we do our part.
Yeah,
That's
we
right.
do our
Yeah.
part.
Yeah.
That's
This
the
is-
main
this is
thing.
Yeah,
what
yeah.
it-
All you can do is educate,
Yeah.
right?
Yeah.
This
You
is
can
what
educate,
it
you
is.
can, you know,
Yeah.
talk to patients, you can give them the choices.
Yeah.
Yeah.
Ultimately, you have to make the right choice
Yes.
for you
Mm.
and for your kids. And I know a lot of even now new parents, you know, sometimes they've never been vaccinated before,
Mhm.
but now as they have children,
Mhm.
they feel like they need to get vaccinated to protect their kids, right?
Right.
So I think that's a good thing,
Yeah,
Yeah.
yeah.
right? So again, but a lot of people are looking at it that way. So hopefully slowly we're changing the mindset to make sure that people are getting vaccinated and protected. So
And where is the pharmacy again?
so the pharmacy is in Killarney.
Killarney.
So it's the medicine shop in Killarney. It's number 1935 37th Street Southwest.
Okay.
It's in the neighborhood of Killarney. And if anyone has a question, obviously they can get a hold of me there. I'm more than happy to help, and especially for travel needs as well too.
especially
So,
travel.
yeah.
Nice.
That's important.
Awesome.
Yeah, that's great. It was so
Okay.
good. Yeah, I was asking you those kind of questions so that people get the message.
That's right.
It is important that they know in a very simple words.
Yeah.
This is what it is
Yeah.
and what is important and what
Absolutely.
is.
Absolutely.
So that's
Okay,
great.
thank you so much.
Thank you so
It
much for
was-
being here
Thank you
and
for having me. No, I appreciate it.
Inshallah,
Driving
we'll
all
do
the way
again
here.
in near some time.
Yeah.
Absolutely.
We'll be active because I think we have to educate. We have to do our part
That's
Yeah,
right.
Yeah.
to educate people,
Yeah.
our viewers and listeners, and hopefully they can spread the message
Spread the word.
to
Yeah,
their
absolutely.
to their
Yeah,
friends and
absolutely.
families.
Absolutely.
Definitely.
No, thank
If you're visiting India or Pakistan or anywhere in the world, please do visit Amyn Kanjee. He's in Killarney. And what's the a shop called? Medicine shop.
Medicine
Medicine
shop.
shop.
Yeah.
Medicine shop in
Medicine
Killarney.
shop and pharmacy in Killarney.
Yeah.
Killarney.
Yeah.
Thank you so much.
Okay.
I think we can say our goodbyes also.
Yes, we can
so
also
that
goodbye,
we
yeah.
take few pictures
Sure.
for our
Yeah.
Facebook.
Sure.
Yeah. So I will be talking too long.
That's okay.
He can understand.
Yeah, of course, everybody understands. So उम्मीद है आप लोगों को हमारा ये प्रोग्राम, ये सेगमेंट स्पेशली जो फ्लू वैक्सीन्स के बारे में था, इट वाज वेरी एजुकेशनल. आई होप आप लोगों ने इससे काफ़ी सारी चीज़ें मालूम की होंगी और हम चाहते हैं कि जैसे कि इन्होंने बताया कि सिर्फ 30% public is vaccinated, which is not right because you are making other people sick by not getting the vaccination. तो उम्मीद रखते हैं कि आपको इनके सुनने के बाद काफ़ी सारी नॉलेज मिली होगी. तो आप जाइए और फ्री वैक्सीन है, ये नहीं है कि आपको जाके इसके लिए कुछ पैसे खर्च करने पड़ेंगे. आप जाइए, जाके वैक्सीनेशन लीजिए. और अगर आप ओवर 50 हैं तो शिंगल्स की बहुत इम्पॉर्टेंट है, और अगर आप अराउंड 70 हैं, 65 के ऊपर हैं, तो आप निमोनिया की भी वैक्सीन लें, स्पेशली अगर आपको कोई क्रॉनिक इलनेस है. तो इतनी सारी चीज़ें आपको आज मालूम हुई हैं. तो उम्मीद रखते हैं कि कल सारी फार्मेसीज जो होंगी सारे लोगों से भरी हुई होंगी और सब लोग वैक्सीनेशंस ले रहे होंगे. दैट वाज आवर एम टुडे, टू गेट यू एजुकेटेड. So thank you to Amyn Kanjee for coming all the way from the south and educating us, and through us you got the education. तो उम्मीद रखते हैं कि इसी तरह हम और लोगों को भी लाते रहेंगे, डिफरेंट लोगों को इस तरह आप लोगों को एजुकेट करते रहेंगे. तो आपको हमारा ये सेगमेंट पसंद आया होगा. और अब हमें इजाज़त दीजिए क्योंकि 10 बजने वाले हैं, हमारा वक्त ख़त्म होता है. तो हमें खुदा हाफिज़, शब खैर एंड हैव अ वेरी गुड वीक. इंशाल्लाह अगले हफ्ते मुलाकात होगी कुछ और नई चीज़ों के साथ.
इंशाल्लाह.
तो हंसते रहिए, मुस्कुराते रहिए, प्यार बांटते रहिए और अपना ख्याल रखिए. ज़्यादा तेज़ गाड़ी मत चलाइए, कुछ पता नहीं होता है वेदर का. तो इंशाल्लाह आपसे अगले हफ्ते मुलाकात होगी. अल्लाह हाफिज़.
और guys, thanks for watching जो हमें Facebook पे देख रहे हैं और पर so I will be downloading like on YouTube as well और Instagram देख रहे हैं guys. Thank you so much. मेक श्योर कि जो छोटे बच्चे का तो अभी हमने सुना छोटे बच्चे आपके भाई बहन नेफ्यू नीस को वो जो है ज़रूर ले वैक्सीनेशन. तो इसलिए वो बिकॉज वो बड़े इजीली उनको जो है लग जाता है अपना फ्लू के जो भी सिम्टम्स. और या तो सीनियर्स जो हमारे पेरेंट्स है या तो दादा दादी है, मेक श्योर दे गेट देयर वैक्सीनेशन विच इज़ फ्री, ताकि वो सेफ होंगे तो बाकी जो है पूरा घर भी सेफ चलेगा. बाकी हमें और आप तो सो वी कैन कंट्रोल अवर सेल्फ. तो जितना ज़रूरी जितना जल्दी हो सके आप लेते हैं. इट्स फ्री जो है एनी फार्मेसी और एनी जो है डॉक्टर प्लेस और जो अपना हॉस्पिटल. तो विल सी यू गाइस नेक्स्ट वीक इंशाल्लाह. थैंक यू सो मच गाइस फॉर वाचिंग एंड लिसनिंग ऑन आवर रेडियो सुसंगम, आपका फेवरेट शो सलाम नमस्ते विद मी एंड सलमा जी. तो विल सी यू नेक्स्ट वीक. थैंक यू सो मच. अल्लाह हाफिज़, खुदा हाफिज़, एनी आली मदद.